Hi, welcome to the Life After 50 show. I'm Katherine Watson, and I'll be your host today. Today's show, The 8 Pillars of Brain Health, is sponsored by FindHoustonSeniorCare.com. Find Houston Senior Care is a web directory in the greater Houston area to help families find the senior care and senior living options that they're looking for. We're committed to bringing valuable information to families in need with our informational blogs and the Life After 50 show. Today, I'm excited to host two guests who are passionate about and dedicated to finding answers and solutions for the many people who suffer from Alzheimer's disease. Torie Pendelton is the program manager for Active8 Your Brain at Global Alzheimer's Platform Foundation, commonly referred to as GAP. And Dr. Joseph Kass is a professor of neurology, psychiatry, and behavioral sciences and medical ethics and health policy at Baylor College of Medicine. He is also the director of the Alzheimer's Disease and Memory Disorder Center at Baylor College of Medicine. And I'm happy to bring them on. Let me just bring them up into the show.
Hi, how are you doing?
Dr. Kass.
Hi, pleasure being here today. Thanks for inviting me.
Thank you for taking time out of your busy day to join us today and try to help some families. And Torie, welcome to the program. Thanks for coming on. Oops, I'm not hearing you, Torie. We're not having any sound. So check your audio, please, and hopefully we'll get that situated. Okay, I'm going to go ahead with the program. We are here today. We're going to be talking about the 8 pillars of brain health. That's the title of the show today. And I know there's a lot of people, both professionals that are watching this show and also families that are watching this show, and individuals that maybe you've had a parent with Alzheimer's and you're concerned that it's going to happen to you, and you want to know, is there anything I can do? And what is the latest research and what's going on in that arena? So we're going to talk about that. I just want to check in. Torie, can we hear you yet? No, I'm sorry. We're not hearing Torie. Hopefully she can get her audio fixed so that she can join us on the call today. But we're going to just go on ahead. I'm going to put the first question last because it pertains to the GAP Foundation, so we can learn a little bit more about that from Torie. I'm going to go ahead and bring Torie down into the lobby, and we're going to talk with Dr. Kass about the 8 pillars of brain health.
Sure.
So, Dr. Kass, what are the 8 pillars of brain health? What is that?
Sure. So the idea with the 8 pillars of brain health is that there are things that we can do to improve our lives and reduce our risk of getting dementia, right? So a lot of these things are, you've heard about in the media, but when you put all the research together, it does seem to support the idea that if we, one, eat well, and we can talk about what all these mean a little bit more, if we stay active, if we sleep well, if we exercise our brains, if we connect with our social network, with our family and friends, if we reduce stress and relax, and then we also have controlling our vascular risk factors, so risks of heart attack and stroke, and then also getting involved in research. That's the you sometimes see 6 pillars of brain health, but with the idea of adding the getting involved in research and reducing vascular risk factors, it kind of it makes it a little bit more robust and sends a more complete message, I think, about things that folks can do currently.
Absolutely. So let's just kind of go through some of these pillars, and
Sure.
Let's talk about why we feel, or why the medical industry feels that these are valid pillars of brain health, and what we can do to ensure that we have the healthiest brain possible going forward in our lives.
Sure. So I'd like to say there are two levels of evidence. I would say this is sort of the way I explain it to my patients. So there is one study that came out a few years ago from Finland called the Finger study that does support these kinds of interventions. Is actually when they took cognitively normal people and randomized one group to a very active intervention set, which had to deal with counseling about diet and recommending certain interventions there, increasing physical activity. A lot of the aspects of the pillars that I mentioned, versus people who just got regular counseling about how to make their lives better. There was a statistically significant improvement or stabilization, or you could say, they were looking to see if folks declined at similar rates, or if one group did better than the other. And so the people that were in that active intervention side of the trial, they didn't, or I could say the placebo group, I guess, or the non-active intervention group declined, whereas the other folks had some improvements or stayed around the same. And this was a group of people, it was in their 60s and 70s, who started off with normal cognitive functioning, and then they checked, with a very robust battery of neuropsychological testing to see how they did, not just a 5-minute little test. And so there is so that got people excited, because finally there was a proof of concept that maybe this does make sense. But we've been saying these things make sense even before that study came out, which was quite recent in just the last few years. So if we think about the brain, the organ of our thinking, right, of our cognitive function, it's connected to the rest of our body. And so this is where I'm getting to sort of maybe the more common sense or the face validity of these types of recommendations. And so we know that there are some things that are good for our general health, and that in isolation, there are studies on how people learn, for example, that talk about sleep, or how the impact of exercise in reducing cardiovascular and stroke, risk factors. And we know about the connection of if you're accumulating cholesterol and plaques all over your heart, there's a chance of that happening also in your brain or in your neck, and then those plaques causing you to have strokes, which affect cognition too. So there's also this idea that these vascular risk factors also promote inflammation, which is bad for pretty much any kind of organ in the body, including the brain. And so whether we're preventing, in the end, Alzheimer's per se, or Alzheimer's and vascular dementia, or a combination of both, these are all very positive factors that are going to, move us in the right direction. So, for example, diet, right? So when we talk about good diet, there's tons of evidence that the quote Mediterranean diet, for example, promotes longevity, and it's good for our hearts, and it has one can extrapolate from that too that it's going to have some positive cognitive effects, both in the sense that your brain is part of your body, it's not separate from that, and also in terms of its reducing the risk of vascular disease in the brain as well, and then also reducing inflammation that might also promote the development of things like Alzheimer's.
Dr. Kass, I want to talk for a minute about that inflammation, because I've been hearing a lot about inflammation. It's not something we used to talk about, but lately it seems like everywhere I look, every article I read, they're talking about inflammation in the body and how important that is for our overall health, but also for our brain health. Can you talk a little bit more about that, and what is a diet that one would pursue for inflammation?
Sure. So usually in our day-to-day lives, when we think about the word inflammation, I always think of a swollen joint, let's say, or you get a mosquito bite and you get swollen, right? So, and when I remember when I got to med school, we had all these immunology courses and talking about inflammation, I was like, okay, I had to readjust my thinking from maybe what the layperson thinks of, because it doesn't mean that your brain is swollen, right? I mean, it can under certain circumstances, or that a part of your body is swollen. But what we mean by inflammation is that that your immune system is producing, so it has white blood cells, right, that are supposed to fight infection, but it also, there are other, and they release these factors that cause this condition of inflammation. And so in some cases, yes, that is swelling if it's external and we can feel it. And in infections, often that's the case. But even it can happen that there are inflammatory chemicals that are being released by these white blood cells that promote, for example, damage to different cell types, or that make you more predisposed to having like plaque formation in your blood vessels. So whether we're talking about the heart or the brain or a lot of other organs in the body, inflammatory responses can have pretty deleterious effects. And we know that there's a link, let's say, between cardiovascular disease now and inflammation. And when I say cardiovascular, I'm not just referring to the heart itself, but also really the entire vascular system. So you can imagine, and then we also know that in Alzheimer's folks, that there's a period of time where there's pathological evidence that there are certain types of white blood cells that are in the brain that seem to be activated, and they're trying to deal with, let's say, the plaques, and trying to eat away at those, and not doing a good job being able to do that. So there's more evidence from genetic studies and other studies that the inflammatory conditions are sort of turned on in the brain as we develop Alzheimer's. And so the idea would be that if we can reduce inflammation over, I'd say a long period of time, right? We're not talking about just, when you get the disease, but really the decades preceding that maybe that would reduce the risk of developing dementia or delay it, just like it would improve your risks of not having a heart attack or not having a stroke. So we think about factors that could promote and sort of anti-inflammatory things we can do naturally. So you can go on the internet and probably find, any pill that any person ever wanted to make, and they can throw a label on it. But I think a lot of these 8 pillars, many of them actually go to this issue probably. I mean, when you think about the Mediterranean diet, for example, that's a diet that's high in fruits and vegetables. There's high in whole grains, not very low in processed food. It's emphasizing meats that are leaner, a lot of fish and fish oil, rather than heavy things like fatty meats and saturated fat, a lot of olive oil. And so these things have these positive effects that also affect inflammation, is what we think. And so these component parts we're basically ingesting a lot of nutrients that are anti-inflammatory in their nature, whereas if we eat a more traditional meat and potatoes diet, we're really lacking in those things. And so there's a connection there. For example, sleep is another thing that we know is really important for cognitive health, just for us day to day. Forget about dementia, but I think we all know what it feels like to not get a lot of good sleep. So, but there's also a different, the consequence of not sleeping over the long term probably has some other deleterious effects around inflammation and tolerance of those things. And you go through that stress. There's, again, our external lives are connected to our bodies, and our brain is part of our body. It's not like the mind is a separate, it's all the brain, and it's the organ that's learning and absorbing and creating the emotions. And so there's definitely that quote mind-body connection shouldn't really be all that mysterious, because it is an organ that is within our body. And so we experience stress in a lot of ways, and those ways are physiologic as well, including inflammatory responses being turned on, higher levels of stress hormones that are ultimately going to take a toll on our bodies in a number of ways. So that's another reason why that pillar makes a lot of sense, in terms of a connection. There are other things besides inflammation probably that are connected there, but if that I agree with you, that is the thing that's coming out a lot now, and people are talking about it more, and so trying to make those connections between those.
And I think one of the questions that a lot of people have is, how do I know if I have a lot of inflammation in my body? Is there some kind of test that can be done? How do we know this?
Right. So, I'm sure there's a clinic where you can go to and they'll tell you all these things. And I would, so there are, there are blood tests, like if a person has like arthritis, they have rheumatoid arthritis or other inflammatory conditions that are very aggressively inflammatory, there are blood tests that will come out abnormal that tell you generally that there's an inflammatory response going on. But people can have inflammatory responses in the brain that don't show up in blood tests like that. And those blood tests can be positive for other reasons as well. So there's nothing, so again, there's the obvious inflammation of the person with these horribly swollen joints, or that would trigger a positive test. But I'm talking about a much lower level. It's kind of like a smoldering fire. It's not a rip-roaring raging fire. And so we don't currently have reliable tests that are going to tell you that. I think that assuming that we all are potentially in that state, given the way we live, the way we eat, the stress we're under, and making positive modifications, regardless of that, to just assume that we need to deal with it and reduce it. And it's going to have, it'll have positive effects. It'll have positive cognitive effects, but also you'll feel better in the moment, not just, it's not like you're sacrificing quality of life for a possible theoretical gain 20 years from now. You're actually probably improving your quality of life at the moment. If you sleep more, you reduce stress. You eat, well, actually.
It's a circle.
Exactly. That's right. And then that also, that's right. It does, because you feel better. You feel better now. It perpetuates it, and then you just
I find when I eat better, I sleep better.
That's right. Yeah, exactly.
When I have better social connections, when I'm getting together with friends, I sleep better.
That's correct.
All of these things seem to interconnect with each other. And if you look at the 8 pillars, I think you'll find an interconnectedness with each of the pillars.
That's right. And what is nice about them is, I think that at this point in 2018, a lot of these things on their face make sense to a lot of people without having to have an MD after their name. You've heard enough, and there's nothing. This isn't go spend $1,000 on supplements that you don't need. This is about, eating really good food that you can buy at the grocery store yourself. That if you're making a choice between, white bread and whole grain bread, if you're making a choice between that salad with olive oil versus, loaded baked potato. And it's not, these are things that it's not like you can never have the treat. We're not talking about weight loss here. We're talking about, it's a quality of life and a lifestyle change that some people have to make. But, they can still have a piece of cake at their kid's birthday party or their grandkid's birthday party. But it's about what you're doing, most of the time. And then in the choices that you make, even sometimes the smaller choices, that extra apple that you might eat, for example, or everybody loves, I guess every restaurant now seems to have like Brussels sprouts and kale salads and things like that. The kale, that's great. Brussels sprouts tend to be fried, whatever. That might be a problem, but there are things that even are, that are sort of, sometimes the fads that come into our, are actually pretty good, like kale, like for example, things like kale.
What about things
greens.
like blueberries? You always hear
Sure.
Blueberries are great brain food. Is there anything to that?
Yeah, well, what happens, the reason that all these, that these fruits and vegetables, one of the many reasons they have, unlike when you take a pill where you're isolating one nutrient, there's probably like so much, it's probably much more complex than just one nutrient, but you have these pigmented fruit that have the pigment is these chemicals that, given their pretty color, are antioxidant in nature. And so antioxidant is a way, those fight inflammatory responses in the brain too. Now, taking a bunch of antioxidants, though, isn't necessarily the way to do it either. And there's data that, there have been plenty of negative trials on those sorts of things when they've tried to intervene with supplements. It does seem like there's something about whole foods. I'm not advertising for the company here, but this idea that you're having foods that are natural and that are, that Mother Nature, made, that weren't processed in a factory, that are very per unit, per unit volume, or just packed full of nutrition. Those things are going to promote our general good health, and including, dampening down on those inflammatory responses. And that seems to be the way to go. So, hey, if you're going to stress eat on those blueberries if you can afford it. Sometimes it's a little bit hard to do.
Sometimes they're a little pricey.
Right. Exactly. That's right.
Yeah. So I heard some really good advice years ago from a doctor, and he said, just follow the perimeters of the store and skip the aisles. And I thought, that's brilliant. That really is, because all of your processed stuff is in the aisles.
That's true. It is. It actually is.
You've got your fruits, your vegetables,
that's
your
correct.
meats, your,
that's right.
Your seafoods, your
that's right.
milk
that is,
products, all of the good stuff.
Right.
And I thought that is excellent advice and so easy to follow.
Right. Yeah. I tell my patients, things that are white tend to not, with some exceptions, except for like in the fish department, let's say, or certain, or tend to be, they should raise a question mark, because it's sugar and processed flour and, things of that sort. So.
Right. Yeah.
But that's actually, the perimeter one is a good one. I like that. That's very
Great.
good.
Listen, I'm going to bring Torie back up. We're going to keep our fingers crossed that her audio is working now.
Mhm.
And hopefully, Torie, can we hear you? No. Okay, unplug your earbuds and let's just see if we can hear you without them. Unplug them from the computer. Can you talk now? Yeah, she still
Is
doesn't have any audio.
it's not on mute by any chance, your computer? By
You,
mistake?
are you on mute somewhere? Yeah, I'm not seeing. Yeah, she's not on mute here. I'm so sorry. We're unable to bring Torie in today, but I am going to put up some information about the Global Alzheimer's platform so that you can get some more information about that. And also, there's another website I'm going to put up in a minute here called memorystrings.org. Both of these websites have a lot of really great information. Dr. Kass, let me go back to you. And Corey, I'm just going to bring you down into the lobby. Dr. Kass, I want to ask you, where can people find reliable health information, reliable brain health information? There's so much noise out there in the world today, and we got bombarded with lots of different solutions and messages and ideas, and sometimes people are not quite sure what to believe and where to go.
And this is true for every, as we know, for every single type of condition out there. So you put up a website for GAP, the Global Alzheimer's Platform, and that's a great place to start. The Alzheimer's Association is also another place to start. There are certain, academic centers, so tend to have reliable things. So that's another place to look. Unfortunately, there's definitely a lot of commercial. There are a lot of commercial interests that want to sell you a lot of supplements or sell you a lot of unproven therapies, and so one does have to be cautious about that. If you're, maybe the best way of advising folks would be if you're about to throw down a lot of money for something, why don't you talk to your physician about whether maybe he or she can help figure out whether this is legitimate or not, or it's something that through these legitimate groups like Alzheimer's Association or GAP or the Global Alzheimer's Platform, there are people there who might be able to give you some background to help you decipher what's claimed to be evidence, because there are a lot of claims on evidence, but as we know, there are good clinical trials, and there are clinical trials with 5 people that have no validity whatsoever. So I think that because even very educated people who are not used to thinking about medical trials and medical information just aren't trained to think in those ways and to know how to appraise the data that sounds on its face to be legit, but really ends up being kind of specious. So that's it's a lot of consumer beware,
right
out there. But I do think academic centers and big organizations, and the other thing is those organizations especially are very much patient advocacy or family advocacy related. So there's no, if people are skeptical about pharmaceutical trials or industry related things, then they're looking out for patients and their families as well. And so, but I would say that everybody who's in this world is very invested in trying to find solutions. So nobody is invested in keeping anything away from people that would help. And so there's always, a lot of times that kind of antagonism is set up by people who are trying to sell things. They're like, well, your doctors are hiding this from you. I'll tell you, that's, I'd be thrilled if something cheap and over the counter that, you could buy at a health food store would cure my patients of Alzheimer's. That would be a dream, wouldn't it? But so far we have not gotten there.
Yep.
But I did want to mention one of the other pillars of brain health, and that's one of the important things about GAP as well, is that because that's a consortium of, it's an organization that helps academic centers or vets academic centers, right, like ours, to for appropriateness of doing clinical trials. So there's a lot of investment in clinical trials right now, trying to and looking at people who are cognitively normal, as well as people who are maybe at risk of developing Alzheimer's based on family history. And so part of that pillar of getting involved in clinical trials is important, because you could play a role in advancing science, and there also are prevention trials that are pharmacological in nature, and so we need people who are interested, especially if they have a family history, and then they get screened with different blood work and scans and things like that to see if they would qualify for that, and then they might be. It's a placebo. These are placebo-controlled trials, right? And so people get a placebo, or they might get an active medication to see if that medication would prevent cognitive decline in people who are at risk of it. So. And then the same thing would go if you have a family member, or if you yourself think you're experiencing just early, like mild cognitive impairment. So you're still functioning, you don't have dementia, hopefully never, but yet, but you're noticing some issues that there is a lot of, most of the clinical trials now are focusing on that cohort, because earlier ones had failed when they dealt with people who had better, well-established Alzheimer's. And so by moving up the time frame and presumably then the biology of the disease, the idea would be maybe intervening at that point would help, like basically slow down, I won't say cure at this point, but maybe slow down progression and, give people longer time.
That is huge. That is huge. If you can push back the clock 3, 5 years even, for somebody, that can make a huge difference in their lives, in their families' lives. When somebody has a disease that is debilitating, that goes on for 20 years, or even 10 years or 5 years, it's really, really draining on the entire family.
Without
And
a doubt.
it's expensive, it's financially draining, it's emotionally draining, it's physically draining, it's just draining.
Yep.
And so if you can push back the clock, then I think that's awesome. So somebody has a little bit of cognitive dysfunction, but they still can live at home alone,
That's right.
maybe with a little extra help brought in or something like that. That's going to make a big difference in their lives and the
without a
lives of their
doubt.
families.
Without a doubt. They can still drive, maybe, and still have that social connectedness they need, all those kinds of things, and just feel like an independent adult, even if somebody's just over their shoulder making sure they do their bills the right way and they don't forget certain things. But otherwise, there's still, that's quality of life, and that's really, really important. So I think although we all want to get to a cure eventually, I think I'm going to presume that initially what we're going to see are medications that are effective in slowing down or delaying the progression, and then maybe even pushing it to people who have the biology of the disease going on in their brains before they have symptoms. So that would be maybe we would arrest, or again really, really, really slow down their progression from just having abnormal protein folding in their brain to actually having clinical symptoms. And the other thing is, as people are living longer because their cardiovascular risk factors are better managed, both through lifestyle, but also through taking their blood pressure medications and taking their cholesterol medications, because that's the other thing about cardiovascular risk factor. That's the seventh pillar there. Again, it's all connected, and those things also diminish inflammation. That's one of the ways that we think maybe the cholesterol medicines help, is by also working in that way too. So you're creating a healthier body and a healthier brain that way. So that means fewer people, the chances of dying of a heart attack or a stroke are going to be a lot less, right? So if you're investing in that direction, then even offsetting the onset of cognitive dysfunction by 5 years or 3 years would give you more time to enjoy your life. So positive things that way. So hopefully we'll see those developments in the next few years.
I'm hoping so.
Yeah, me too.
I think we're getting there. Dr. Kass, I want to thank you so much. The time, unfortunately, is up, and we do have to close the show. And Torie, we'll get you on again at another date and bring you on. But I'm going to go ahead and put that web address up on the screen so that people have the Global Alzheimer's Platform.org. and also memorystrings.org/activate your brain. And she does have a Facebook page for Activate Your Brain. You might want to go there and connect with Torie. This is Catherine Watson, and I am with the Life After 50 show. We bring you every week interesting information that can help you manage and navigate this wild new world of life after 50. Next week, we're going to have a really interesting guest. Bob DeMarco will be on, and he is an Alzheimer's advocate. He has cared for Alzheimer's family member for many, many years and has a lot of great information to share with us from a caregiver perspective. So we're excited to have him on next week. That's Bob DeMarco. Join us Monday, and we will have the Life After 50 show. Thanks again, Dr. Kass. I appreciate you taking your time today.
Thank you so much. And if folks are interested in getting involved in clinical trials, our center at Baylor does many of those, and we'd be happy to talk to them as well.
Great. Thanks
Thank
so
you.
much. Have a good day.
Thank you. Bye.